Hi, my name is Ursula Knight, and in this presentation of my concept map, I will present to you Elizabeth Barrett's theory of power as participation in change. This theory also resulted in a power of participation tool where imagery has been used. Barrett has been known to base her theory and commitment to nursing on theorist Martha Rogers' science of unitary human being whole. The power of participation in this concept map is ever-changing. This is important to the nurse, especially to the consumers of healthcare and the environment in which care is received. It changes daily. This theory, there is an expectation for consumers of care to participate in decisions and the knowledge that is provided by the nurse. There are fields of change. These fields of change can be invisible, unpredictable, and consist of the human and the environment. As you can also note in this concept map, this model also gives an example of freedom, allowing the patient to have that freedom to participate, allowing that patient to have that freedom to know that the change is occurring, which will also help execute that theory, which is related to commitment to nursing. In Barrett's theory, she also made it known that patients can participate in their change, in their situational change. So dealing with patients in the community and providing them with knowledge and to the access to their resources is a great value to them. Being able to provide this population of patients or consumers of care and how they can participate and knowing how they can participate in their care just by providing them information on their disease process is unlimited. I also find explaining the change and how it occurs to this patient population. For instance, a diabetic patient who repeatedly comes to the emergency room because they can't fully understand why their blood sugars are always elevated. They can't understand how this change occurs. When they're in the hospital, they're fine, but when they go home, there's a change. Explaining to them that they have the knowledge and can participate in their healthcare based on where they're shopping, the foods they eat, and what's available to them in their neighborhood or in their environment. Letting them have the freedom to make decisions involving their care. It's very important to me. I find in my practice when I'm able to include the patients in their decisions and what their environment consists of, it provides that patient that knowledge to want to participate, helping them understand that their participation also can result in safety features and safe outcomes of their care. The diabetic that I mentioned earlier, long-term, is able to understand their disease process, understand when a change occurs, understands that their process is always changing, and just understanding how they can participate in the knowledge base of that disease. Acknowledging to the patient that they have this power also can be delivered in a worldview. Explaining to the patient that power can be used as a form of control. If they're able to control some of these changes and acknowledge them, they could have better patient outcomes. What we must also recognize with this theory is that it's been written in multiple languages, which means it's worldwide. There's worldwide participation. And for patients to participate in their healthcare, it also helps with prevention and health promotion. Theory of power. Humans have the power to actively participate in change. There are dimensions of power in practice, which may include awareness, choices, freedom to act intentionally, and involvement in creating change. The four concepts of the nursing meta paradigm include nursing, environment, health, and person. All play a role in the power of participation. Nurses are available for continued advocacy regarding changes which occur. The patient is able to understand and recognize the environment where there are continuous changes. Participation in the decisions regarding the health is encouraged. Allowing the person or patient to have the power to control all aspects of participation is very important. Here, you will note the importance of what one chooses to do and while doing it intentionally.